So, good evening, everybody. Thank you so much for joining us. Today, November is actually no- known for lung cancer awareness. It's called Lung Cancer Awareness Month. So, the pressing issue right now for lung cancer, all of us know that smoking is the most common cause of lung cancer, and lung cancer is becoming one of the most common in the country right now. The pressing situation right now is that the addiction is starting very early, thanks to the e-cigarettes and vapes that are in rampant use right now. Even though it is banned in India, we still see a lot of teenagers using it. So, to talk to you a little bit about smoking, the perils of vapes and e-cigarettes, the addiction that it causes, and what steps you can follow for de-addiction, we are very lucky to have Dr. Virinchi Sharma. Is a consultant psychiatrist and the director of Manasa Hospitals, and he's one of the youngest, most dynamic, a very good friend of mine, and I'm very lucky to have his time. So, Virinchi, welcome. Thanks for joining us.
Thank you. Thank you so much,
So,
Karan, for the wonderful introduction. Thank you so much.
yeah, so we'll start off with a simple question. What exactly is a vape, and what, as a teenager, as somebody who is just out of school, going to a store to buy a vape, what should he be aware of?
Well, firstly, when it comes to substance use, nicotine is one of the commonly used substances all around the world. So even though alcohol always tries to dominate the picture, nicotine is one of the commonest substances, and like you mentioned, something that starts off at a very early age. And now, in the forms of nicotine, we all know that cigarettes have been the one that have been prevalent for decades now. And the newer forms of nicotine deliveries, the electronic cigarettes, the e-cigarettes or vape, has been in the market at least for the last couple of decades. And like you mentioned, I think in the last one decade, we have seen a rampant use of it, even in the younger population. So coming to the question, well, an electronic device which has probably lesser chemicals than a cigarette, but has nicotine which is there in a vaporized form, which is inhaled by individuals, is in a simplified form how a vape is being used.
Okay, so why, like all these kids right now think that using a vape is safer than using a cigarette? So, even up to the people who are actually using it already, what do you think they should know in terms of the quantity of tobacco and harmful chemicals that they're absorbing because of the e-cigarettes?
Well, firstly, when it comes to the safety, it's very unfortunate that, a lot of individuals speak about, safety to many substances, and, sometimes when these things are, legal in a few countries, people believe that, it is safer. So, well, chemically talking, the nicotine content that is there in the cigarettes is, the same in a lot of vapes. And if you look into a few studies, there are some vapes which have more nicotine content than, what a conventional cigarette has. Well, coming to the safety, probably, one point that I can give to people who believe this is that the chemical compounds, what, a conventional cigarette has, which has more than, 700 to 7,000 toxic compounds. I think you're a better judge to talk about it, which can cause cancer. Those chemical compounds are lesser in an electronic cigarette or in a vape. But when it comes to the nicotine delivery, it is the same way. When you inhale it, the time that it takes to reach the brain is less than 10 seconds. And there are a lot of again, just like cigarettes, even in vapes we have different qualities which have different levels of nicotine. And unfortunately, nobody has a clear idea about what it is. And especially, like you said, in a country like India where it is already banned, it is illegal. So what
Yeah.
the vape contains is not what anyone actually knows, because there is no regulatory body that is working on it. And people believe that it is safer. It is a myth that they believe that having a vape is much better than having nicotine, or having a cigarette. And they start using it at a very early age. Now, since it's illegal, there is no regulatory body looking at who's buying it, because everybody buying it is, buying it against the
Yeah.
law. So now that makes it very difficult to actually understand how much of nicotine is there. Are they using any other chemical compounds in it? Because all that the individual enjoys is that, it has a flavor, and two, it has low
Yeah.
smell, and that's what a youngster wants, who wants to hide it from their relatives or family members while they're using it. And that's how an individual gets addicted into it. Undoubtedly, the nicotine content in it is as bad as it is in the cigarette. And once this nicotine starts going into the brain, it activates a particular receptor called as the acetylcholine receptor. Now, normally, the body has its own chemicals to activate this receptor. But when the brain starts receiving this particular nicotine from outside, the brain is no more interested in producing this nicotine from inside. And that's where the
Got it.
whole concept of addiction starts. So there is more and more dopamine coming from outside. So the brain believes, okay, now there is enough dopamine coming from outside, so I don't need to prepare the dopamine anymore. And this causes the whole sequelae of symptoms which an individual with addiction has.
Yeah, so rightly put, I said. So the main problem with these e-cigarettes is the nicotine. That is the factor, the reason why these young kids are getting addicted at such an early age. And unfortunately, it's become like a cool factor for them. So, being in a party, being social, and everybody has a vape in their hand, and they think that they're enjoying the flavor. So, yeah, unfortunately, it's become a cool factor, and they're enjoying the flavor of it, and at the same time, they don't know what harmful substances are ingesting. Like you said, most of these e-cigarettes have actually more percentage of nicotine than a regular cigarette. So, before this talk, I was doing a little research on e-cigarettes, and it says that there's a compound called formaldehyde, which is there in e-cigarettes. That is actually 10 times more in an e-cigarette than in a regular cigarette. So that becomes the cause of lung cancer, even though, even if you are a regular e-cigarette smoker and not a cigarette smoker.
I think this is a very interesting thing that you brought in, Karan, because like you mentioned, it is a cool factor, and unknowingly, I see that individuals are having it more. See, because the ease of having it, where you do not need a
Exactly.
separate smoking room. I know a lot of individuals who walk into a restaurant or walk into a public place and also have it, where probably a cigarette is not allowed. So, maybe because people are allowing an individual to do that, people start believing that it is safer, and unknowingly you are
Yeah,
consuming quantity of it. And there are a lot of studies which speak about how 10 puffs of a vape is equal to one cigarette.
yeah,
So the
yeah.
number of puffs an individual is having from the time he wakes up, because there are a lot of people who complain to me saying that the first thing that they do as soon as they wake up is have a puff of vape. So the vape is right beside their bed.
Yeah,
So I thought it was only the phone that was coming into the bedroom, but now the vape has also entered the bedroom. That's a dangerous thing.
yeah, it's become like an accessory now. Everybody's carrying it everywhere. So,
Right, right. Very.
yeah, so apart from the young people, the other problem that I was seeing that people who are chronic smokers who actually smoke a pack of cigarettes a day, they think that vapes will help cut down the amount of tobacco they're taking in, cut down the amount of harmful chemicals they're taking in, but at the same time keep their addiction going. The nicotine feeding is going on into your body. So do you think that, would you suggest that as a step to de-addict yourself from cigarettes, to use vapes?
Well, unfortunately, globally, if you see, this has been being practiced. But if you again look into the research, if you look into the exact data, it is less than 6% of people that have converted into vape, thinking that their nicotine delivery is reducing and I'm going to come out of this habit. It is those less than 6% of people who are able to come out of it. So maybe, those 6% are the ones who are well determined. Maybe it is like a placebo for them, or maybe they are using it in a very in a very controlled environment, where probably the
Got it.
doctor tells them that this is the first step that you do for a limited period of time. So we all know, the first thing that our patient says, I want to cut down, and they are not able to decide when they want to cut down, and that itself is a bad thing. So whenever we are trying to reduce somebody with a substance, there should be a fixed goal, a duration when they want to cut it down. If that is not happening, and if someone believes that, okay, I converted into vape, so now I can continue this for life, they are at a greater risk of giving more nicotine to the brain, and they are a greater risk of a withdrawal when they want to stop that vape also because of the increased nicotine
Yeah.
level.
So up to some extent, if it is in a controlled manner, you think that it is a good way to wean off from the cigarette smoking.
Well, again, I would say this only in a country where vapes are, legally being given, because
Okay.
they have those
Okay.
different nicotine levels in each vape. So the doctor usually decides as a replacement therapy how many smokes he is having
Got
and
it.
what percentage of nicotine through the vape has to be given. So it's something like in India we give nicotine tablets or nicotine gums or
Okay.
nicotine patches. But
Yeah.
now, someone opting that option in India without, a regulatory body for the vape is a very, risky thing. What an
Difficult.
individual is, if you ask me.
Okay. So now we spoke about addiction and we spoke about what all the harmful effects that it can have on your mind. Could you give us some tips on de-addiction, on how to go about it? What would be the first step? Because that is something that everybody would love to know.
Well, I think the first important thing about de-addiction is the willingness of the individual, because a lot of times what we realize is a child, who's caught smoking by the family members, or the child who's caught with, the vape or, with alcohol, is brought to the hospital by the parents, where the child is still not very clear about if his behavior is a harmful behavior or if his behavior is an addiction. So a lot of times they believe in these myths. So the most important thing that we start off is with psychoeducating the individual. We talk about the real data that is available all around the country, which speaks about what are the kinds of damages it can do, how much quantity can damage to what extent, and at the same time we let them know about how dangerous it is, which I think you should be talking about next. Maybe once I answer this question about what is the risk of using it, and what is the risk of developing cancers. So one, psychoeducating the individual. Two, understanding the quantity of their consumption. So once we know the quantity of their consumption, we can look into a fixed regimen where we can look into one detoxification first, where we gradually start tapering the quantity if the person is willing to, or if the person wants to go cold turkey on it, we help him with some replacement therapies where we bring in either nicotine gums or nicotine patches. And that is also again for a fixed period, because I know individuals who get addicted to nicotine gums also. So we don't want something like that. So for a fixed period of 3 weeks or 4 weeks is where we bring in the detoxification. And then the phase of de-addiction comes. In de-addiction, we bring in some FDA approved medicines, which are now available, medicines like bupropion, medicines like naltrexone, one which makes sure that the dopamine release is there to the brain, which can cover up to the dopamine that the brain was getting through the nicotine, and at the same time something that works on anti-craving also. So one, de-addiction is not a simple process. We need the willingness of an individual. It is going to take some time, and we always keep telling the individuals that there can be relapses or there can be lapses. A lapse is when an individual goes back to the substance. Probably somebody who was smoking 20 cigarettes goes back to 2 cigarettes a day, and we don't discourage him at that point because these are expected. A relapse can be when he goes back to smoking again 20 cigarettes a day, which is again a possibility because of the social environment. But it is a time-taking process, but the success rate is high with these FDA-approved medicines, if you ask me.
So I'll ask a very common question. What was in among all your patients who came to you for addiction? What was the strongest reason or the most common reason that you found among your patients which made them, go through this process and finally come out victorious?
You mean what is the strongest reason why they wanted to come out of it?
Yeah, yeah. So
I
What
think
I
this is a
read
very
is, what I read is most of the people, uh, do it for their family, like for their wife or for their kids, or they make a promise to somebody that they want to quit, and then that's the beginning for them. So, what is the most common, the strongest reason that you found amongst your patients?
well. If you ask me, Karan, like you said, I think yes, a good family support where one of the family members encourages an individual to do this is something one of the biggest reasons. But at the same time, I think uh, you know. individuals understanding the risk of it, where they see one of the family members being diagnosed with a serious illness. It can be a COPD, or it can be a malignancy. This has been the reasons where we see an individual coming to us, approaching us to come out of this substance. And I feel this is where a lot of awareness in regards to the harmful effects of it is necessary. And one of the important reasons why I feel very privileged to be a part of this session is because, like you said in the beginning, this is the lung cancer awareness month, and a lot of individuals do not know that the lung cancer is commonly present, or it is being diagnosed. So just like mental health issues, a lot of people do not talk about cancer, so we do not know about the numbers, which I would request you to please highlight about, what are these numbers, because I really wanted to understand so that I can tell my patients also. So a lot of people ask me how common is a lung cancer. A lot of people ask me, what are the different stages, and can we come out of it if we are detected in a particular stage? So I would ask you to shed light on that.
Yeah. So regarding social issue, I think a psychiatrist and oncologist have to go hand in hand, because it's a very common thing that one of the main reasons for a late diagnosis of any sort of cancer, most commonly breast cancer, is social stigma, because they don't want to talk about it. They're scared of it. They think that they will be left alone in the society and nobody will go close to them. So psycho-oncology, is, like we call it, is a very big part of our initial counseling session that we have with our patients. Moving on to lung cancer. So, lung cancer is right now the second most common cancer in the world, even more so in our country also. So, breast cancer is the most common, and lung cancer is the second most common. Being so common, the problem with it is that there's not much we can do to prevent it. The one and only and the main reason is smoking, like all of us already know, whether it is smoking tobacco or smokeless tobacco, whatever form of tobacco that you take is harmful to you. What they say is, if you're smoking a pack of cigarettes, that is 20 pack years of cigarettes, you are a high risk for lung cancer after the age of 50 years. So, based on this, for people who are chronic smokers, they have come up with preventive guidelines where you do a CT scan every year, depending on the amount of damage to your lungs, every 6 months or every year. One of the concerns with this is people say continuous CT scans can give a lot of radiation to your body. So the CT scans that we use for screening lung cancer are low dose CT scans. So it is a very low dose of radiation, which can be done periodically. This is the only proven prevention screening method that is recommended for lung cancer right now. The other unfortunate thing about lung cancer is many of them are diagnosed late. For other types of cancers like a throat cancer or a breast cancer, there are so many different factors to it. In the sense, like I said, social stigma, they don't notice, lack of awareness, lack of access to good healthcare, that they don't, even the primary health doctor that they go to can't identify that it is a cancer, and they keep prolonging it. With lung cancer, unfortunately, the other main reason for late diagnosis is because unless the lung tumor is very close to the center of your chest, where your breathing happens, right? So that is when you experience symptoms at an early stage and you catch it at an early stage. The problem is most of the lesions are in the periphery of the lung. So the symptoms don't show. The symptoms start showing once it spreads to different parts of the body. So we have patients who come to us saying that they have a back pain. They get an MRI done with an orthopedician, and then they realize that the bones have lesions in them already. And then we do a scan of the chest and we find a lung lesion. So being at high risk for lung cancer, smoking is definitely there. It increases your chance by twice, more than 100% chance increases smoker versus a non-smoker. But even if it is a non-smoker, don't think that you're away from the danger, because every small thing in and around in your environment, whether it is the place where you live, the place where you work, the place where you travel, how you travel every day, how much pollution are you exposed to every day. There is a study that has come out from the US which says that the radon gas that is emitted from the Earth's surface, that is causing lung cancer. So these are some of the things that you don't really think about, and don't really, you can't even control if you want to. So the best thing that you can do is be wary of every environment that you're in, and every kind of air that you're taking in, no matter where it is. Moving on to the treatment, unfortunately, like I said, most of them come in the last stage where it's already spread to different parts of the body. So lung cancer, like other cancers, has four stages. The first stage is where the tumor is located only in the lung. The second stage is depends on the size. If it is a larger tumor and it has spread to the center of the chest, that is the lymph nodes in the chest, it is stage two. If it is spread to the opposite side, it's stage three. And when it spreads to the rest of the body, it is stage four. Up to stage three, the chance of cure for lung cancer is 60%. That means even in stage three, the most locally advanced lung cancer, 6 out of 10 people can get completely cured. In stage four, luckily, this is one of those cancers which can, uh, which in which you can prolong your life even if you're stage four. So, because of all these different types of the latest craze that is going on is immunotherapy, where they recently said that there's a study where it had 100% response and it can cure cancer. Something like that had come a few years back. Immunotherapy is different from chemotherapy. I will explain it to you later. So, with these, some of these drugs with tablets and injections like these, you can prolong your life to 5 years and above, even if you're in stage four. Without causing side effects to the patient, they'll live a comfortable life. Just take these tablets, medications regularly, and we can prolong the life. But whatever you're doing, you're prolonging life, you're not curing it. So, catching it in the early stage, identifying your risk factors, whether it is smoking, whether somebody in your family is smoking, the environment that you live in, the place where you work, the place where you live, all these, it is very important that you identify them. If you think that you're at high risk, be sure to go. Even a pulmonologist is okay. They will easily monitor you. They'll keep us do a CT scan once a year. Any small nodule that is found, they can easily, investigate it and get rid of it. So this is in just, yeah,
Well, I think you very well explained starting from the etiology, the causative factors to the various treatments that are available. As a layman, a lot of people who ask me questions, which you did explain, but if I may ask a question on that, you did speak about
yeah.
how an individual smoking one pack of cigarettes is at a risk of developing the lung cancer after the age of 50. So
Yes.
when we are talking about this, nowadays, like we spoke in the beginning, we have people who get into smoking at a very early age. So from the onset of smoking, how many years is when the risk starts? So suppose a person starts smoking at the age of 12 or 13. When does the risk actually start for him? And when you spoke about one pack of cigarettes, is it a pack of 10? Is it a pack of 20? How many cigarettes is it?
So in the study that they did, a pack means 20 cigarettes. So 20
Right,
pack years is what they said. So 20 pack years, you're smoking a pack of cigarettes every day for a period of 20 years. So
right.
the cutoff age group that they calculated was from the age of 20. So 20 pack years, you smoke till the age of 40, and 50 and above, you're at high risk of getting lung cancer. So lung cancer is usually the common age group that is seen is 50 and above. That is a median age group. It is very rare to happen in young children. So even if you're starting now with all these waves in the future, vapes, I'm sorry, in the future, we might see people getting lung cancer at a younger age, because if you're starting at 15 and you calculate 20 years from now, then you'll have lung cancer patients from 40 years of age itself. So
Right.
as per the data right now, 50 years is the high risk, and 20 years of a pack of cigarettes every day.
Another important question is a lot of smokers who want to stop smoking come and ask me when is the right time for them to get a CT scan of their lung, probably they believe that, because today the medical science has moved where we want things on paper than the, expert telling, unfortunately. So, when you want it on paper, I think one investigation is the CT scan, like you said. And like you mentioned, there is a low frequency, so it is not hazardous also for them. So when do you think is the right time an individual should go for a CT scan? Because now, when you say that, if somebody smoking at 20 might get a cancer at 50, a lot of people would not want to worry about it till 45.
Yeah, yeah.
So when do you think is the right time they should get the CT scan done and start working on it?
And the simplest way to put it is after seeing this session. As soon as they know that they're a smoker for 20 years, they should start screening themselves. So, yeah, that's a good question. So the studies say 50 years and above, but people will always trying to find the loophole and say 50 तक तो मैं ठीक हूँ बाद में देखता हूँ. But now that we are trying to spread this awareness more and more, I think they should start at the age of 40 itself
Another
because
important thing that I wanted to ask you
yeah,
was, I'm sorry,
yeah.
you were saying something.
Yeah, because we're seeing more and more cancers in young people. Even breast cancer, before it was, a cancer of the elderly, 50 years plus. Now we are seeing pregnant women who are 29, 30 years also getting breast cancer. So it's, better to be cautious and start at an early age.
Another important question which a lot of individuals ask me is, probably from the Google knowledge that they get these days, they tell me that, though they are smoking, they are detoxifying their lung. So they are detoxifying their lung by using some Ayurvedic medicines, some homeopathic medicines, and at the same time they say that I drink 4 liters of water or I participate in a physical activity. So is there evidence to any of these activities preventing the lung tissue from the harmful effects?
So from the harmful effects of smoking, the best way to, turn it around is by stop smoking. Whatever Ayurveda, homeopathy, whatever they use, that most probably works as a placebo. If they're using that and still smoking, it's not going to prevent the damage, right? And there is no
Right.
data to say that Ayurveda and homeopathy actually will help, prevent breast lung cancer. But if you're smoking and you decide to quit smoking, the lungs by itself, you forget about lungs, we've studied this through medicine that every single cell in your body, as soon as you quit smoking, start regenerating. Your post quitting smoking, and if you want your lungs to recover faster, then things like pranayama, especially to prevent COPD. COPD is a big, causative factor for lung cancer. So the idea is that you have to get your lung as healthy as quickly as possible. So Ayurveda, homeopathy as a placebo, it might work, but deep breathing, yoga, pranayama, these kind of things really actually make a difference.
Well, another layman question that a lot of individuals ask me is, they come and tell me that, Dr. Virinchi, there are a lot of doctors apparently who say you can have 2 drinks a day. So I then explain them that, it is not the doctor telling have 2 drinks, but it is when the patient says I still want to drink, when the doctor says no, it is the
Yeah.
doctor who says not more than 2 drinks. So now, similarly, a lot of individuals they want to understand, because especially when it comes to addictions, somebody who's having 20 cigarettes a day comes and tells me very clearly that, doctor, my plan is to not cut it down totally, but I want to bring it down to probably 2 cigarettes a day or 3 cigarettes a day. Now, I know it's a very tricky question that I'm asking you. If there is someone who does not want to stop smoking, what is the minimum amount of nicotine that they are allowed to take? Or is there any data which speaks about X number of cigarettes which can be less harmful?
Unfortunately, no. There nobody has even tried to think of it that way or did a study that way. But there's really no cutoff. Like even for drinking, with respects to cancer, they say that 30 ml a day or about 90 to 120 ml a week is still okay to drink. Occasional drink is still okay, but nobody knows. You're not going to put 100 people together who has 120 ml and see if they got cancer in their life, right? So there is no data for it.
But definitely, when you're cutting down from 20 cigarettes to two cigarettes, and then you add things like pranayam, or giving ayurveda, you have some other healthy habits, that you're maintaining your immunity well, you're working on your lungs getting better, then it might make a difference. And like you were also mentioning before, it'll also help them wean off. So it won't have to be two cigarettes forever. It can be two cigarettes for some time, and then they wean it off.
Right, right. Well, Dr. Karan, since we are talking about lung cancer awareness, do you want to share your experience about treating patients with lung cancer? When somebody comes with in stage one, stage two, how long does it take for an individual to come
Yeah.
out of the whole
So
treatment?
yeah. So I will in general tell you about all the treatment options and how they're placed according to stage of the disease. So stage one, of course, it is the most highly curable. 90% of stage one cancers are cured. Initially, it largely used to depend on the function of the lung of the patient, because if the rest of the lung is damaged, it will be difficult for them to operate, remove that part of the lung, and then to have a normal life later. Now, luckily, because of the technology, we have an alternative with radiation. So instead of going through the surgery, especially because I said 50 years and above, usually people have weaker lungs and it becomes difficult for them to go through the procedure. Even anesthesia becomes difficult. So with radiation, with just 3 to 5 days of radiation, we can get completely cure you of the disease in stage one, and the results are equal to surgery. So stage one, your options are surgery and radiation, or radiation, I should say. In stage two, again, surgery would be the primary treatment. You might have to add radiation as a precautionary treatment. So I tell all my viewers that usually when I do these awareness events, apart from the cancer being curable when you catch it in early stage, your treatment also is that less intensive. So even in breast cancer, you get it in first stage. Yes, it is yeah. So
We lost you for a
even in breast cancer, stage one is plus 90% curable. But if it is stage one, you do only surgery. Then if you go ahead with the stage goes higher, then you need radiation, chemotherapy. The entire process takes about 4 to 6 months. So it is very, very important to, whatever the cancer it is, to catch it in an early stage. So moving on to stage 3, like any other cancer, stage 3 is locally advanced. So it is spread in and around that area, but not to other sites in the body. So when it is locally advanced, you need to do radiation and chemotherapy together. So all these treatments for stage 1 to 3, what I've mentioned, they're all curative treatments. The doctor, depending on the size of the tumor, location of the tumor, age of the patient, all these factors, we consider all of them together and then decide which is the best treatment, protocol based treatment for them, for the highest chance of cure. Once you come to stage 4, that's when the trick that's where the trick is. So we have so many different types of modalities. We do genetic testing, mutation testing. I shouldn't say genetic, it is mutation testing on the lung tumor cells. Depending on the type of mutation that is present, we can just give a tablet to them, and they sit at home, take these tablets, get a chest x-ray done every 2 3 months, and they're good, at least to 2 to 3 years. The other option is chemotherapy that we give for other stages also, stage 4 also. In some situations, we do start with chemotherapy. Chemotherapy will be given every 3 weeks. That goes on for a period of 6 cycles. That's about 3 to 4 months. But chemotherapy does have its side effects. So, elderly people, it is usually difficult for them to tolerate. The latest treatment that now we have is immunotherapy. So what chemotherapy does is a cytotoxic drug that is given into your body, and apart from killing the cancer cells, it is also killing your normal cells. That is why you get the side effects: your hair loss, your nausea, vomiting, whatever. With immunotherapy, what it does is it potentiates your own immune system to fight with the cancer. So the amount of side effects compared to chemotherapy are very, very low with immunotherapy as of now. And immunotherapy slowly is moving into the first line treatment also. Even before chemotherapy, people are advising immunotherapy because it is giving very good responses. But the problem with immunotherapy right now is the cost. It's very heavy on the pocket, so you have to take that injection every 2 to 3 weeks, and each injection costs you about 2.5 to 3 lakhs. And chemotherapy is given as 4 cycles, 6 cycles, or 8 cycles. Immunotherapy is indefinite. As long as it is controlling the disease, you have to keep giving it. So 2.5 lakhs every 2 weeks, that is 4 lakhs a month for a year, would cost you about 60 to 70 lakhs. So affordability is a huge problem with immunotherapy right now. Though there are so many organizations, even the drug companies are coming forward to help to give the pay, you buy one and you get one dose free. So we have so many different avenues for the patient to be able to afford it. So as a whole, these are all the treatment options that are available right now. And lung cancer being diagnosed at a late stage is a problem, but going to the correct doctor, getting a protocol based treatment can still prolong your life. And if you catch it early, you still have a chance of getting it cured. That is 60 to 70% of complete cure.
I think that's but that was wonderfully put down, Karan, because a lot of individuals do not know that there are so many dimensions of treatment, especially when it comes to cancer. Because there are a lot of my patients, who do come down with cancer detection in their family or in themselves, who think that the next stage is death. I think with the whole evolution of science, there are a lot of important treatments that are available. And like you mentioned, I think detecting it at stage one has a 90% chance. That's a lot of relief for a lot of individuals. But I
Yeah.
think the most important thing that I am taking home today, which I'm going to start telling a lot of my patients from tomorrow, is that getting repeated scans done. Because living in that denial that it does not affect me, or my quantity is way too less, or I'm not an addict, or thinking that my homeopathic medicine with my nicotine is taking care or neutralizing the whole thing, is unfortunately where a lot of individuals stand here today. And most
Yeah.
importantly, like you said, people in the younger generation believing that vape is absolutely safe, and believing that it is cool and it is the best replacement for cigarettes, is somewhere dangerous again. I don't know if there is any data, or have you been seeing people who are getting cancer with only usage of vape? I agree it might be a little too early, because the vape culture has started recently. But do you see any health hazards, people coming with health hazards with vape?
Um, at least in my practice, I haven't, and at least in my colleague circle, at least I've not heard of somebody who's coming to you for, with lung cancer because of a vape. But there is data, Western data, which suggests that vape can cause throat cancer and lung cancer. So, like
Right.
I've mentioned before, because of that chemical called formaldehyde, that is, the reason why they could get lung cancer or throat cancer.
So, well, I think that's also an important thing for the audiences, because since there is no data, people might relax about using the whole thing.
Yeah.
So I think, like you said, there is enough data coming from the West, and since it's a new culture in India, I think we might take a little more time to understand about the harmful hazards of it. But we shouldn't be one of those people who are in that study. So at least a younger generation should understand that the vape is absolutely dangerous, and equally dangerous to the cigarettes, the conventional cigarettes that are available.
Yeah, definitely. And more awareness needs to go on because whatever knowledge is there about vapes is still, all what you read online. And you always ending up reading online what you want to read. You want to read good about it, you'll read all good about it. So they read that and then, they console themselves saying that it is, still safe. But like you said, uh, we should consider it as harmful as smoking a cigarette, at least for now. We will definitely have more data to, uh, support that. But as because only young people have started using vapes for now, 10 years down the line, this guideline might come out which says that you have to do low dose CT scans from the age of 30, 35 also. So yeah, they're never out of the risk with by using vapes alone.
Well, doctor, I have one last question from my end at least. There was recently, one of my patient who had come down to me with an Ayurvedic cigarette.
Mhm.
Apparently, this is available on the online portals like Amazon.
Oh,
Frankly, I have never read about, what are the contents of it, and how safe or how dangerous is it. Have you heard of anything like this? And is there any information that you can give to the viewers about it?
Um, I don't want to give any wrong information, but I do know that things like that exist. There something called herbal mix that you get on Amazon apparently, which they're using instead of smoking a cigarette, they roll tobacco and smoke it, thinking that it's safer than tobacco. But we really don't know what is there in that, whether it's harmful or not. And I don't think that people should in any way think that it is less harmful than a cigarette, unless we can have supportive data for it.
I think this is another big take home from today's session, that because there is not enough data, speaking about something does not mean that it is safe. And
Yeah.
because it is available in online podiums, or because the closest pawn shop is giving us an e-cigarette or a vape, does not mean that it is safe. And I think since it's the awareness month, the biggest thing that all of us should understand is, if you are a smoker, or if there is a smoker in the family, I think the first big step is to convince them and get them to the nearest pulmonologist or the oncologist, who can first get the initial investigations done, and take a decision about where the current status of the lung is.
Yes, that's a very good point, Virinchi. I agree. I think that should definitely be the take-home message because it's a Cancer Awareness Month. Identifying if you're a high risk for getting lung cancer, like I said, identifying your environment, making sure what you breathe in is healthy, that goes a long way. And don't be scared or don't have the stigma. Just that because you're going to a doctor to get a CT scan doesn't mean that you have lung cancer or you're going to die. So even if you did go through this, 20 pack years sort of experience through your life, now at least you know that there are ways to catch it in an early stage, even if you get it, and still get cured and have a normal life after. So so the middle ground as a silver lining, like I would say, that is, you made the mistake, that's fine, but at least now that you have more and more data, like everybody is a Google doctor, like you said. So everywhere about smoking you read is bad. Even in movies they're showing that smoking is bad. On cigarette packets they're showing that smoking is bad. So the information is out there. It's just that it needs a person to get hold of it, grasp it, and put it into action, and make sure that you take the right step. And another take home message I would say from your side is vapes are definitely not safe. And don't in any way think that it's a substitute for cigarette smoking. Like Virinchi said, only in a controlled environment prescribed by a doctor, if it's helping you wean off or getting you de-addicted from smoking, it might help. But don't in any respect think whatever age that you started smoking vapes, don't think that it is safe. And be wary of it. As long as you're aware of it, you try and control it, you identify the problem, and you make sure you consciously deal with it. I think that will be a huge step.
Absolutely, absolutely. So well put up, Dr. Karan.
Thanks, Vinci. Thanks a lot for your time. I think this was a wonderful discussion. And like I mentioned, I was talking about psycho-oncology, so we will try and get together again and try to talk a little bit about the social problems of cancer patients and how you can deal with it with the patient and the family as a psychiatrist.
Absolutely. Thank you. Thank you so much for giving me this opportunity. Thank you, one and all.
Thanks, Vinci. Bye.